And with that, I'll turn it over to Dr. Willis for the update.
Thank you, Matthew. Good morning, supervisors. Good morning, community. Alvaro, if I could have my slides, please. I'll offer an update on where we are with regards to our COVID-19 pandemic response, focusing primarily on our case rates and moving into the red tier and our vaccination plan. Next slide, please. I also want to acknowledge that we are coming up on the 1-year anniversary of when we first mobilized the Emergency Operations Center for the COVID-19 pandemic response. It's the longest single mobilizations of our EOC ever. It was on the 4th of March 2020 at 2 o'clock that we announced state of emergency and opened the EOC. And so these numbers now that I'm offering here are the summary of that year. There are cumulative case rates and really describe the burden of COVID-19 in our community. Almost 11,000 total cases we've experienced among our residents. 342 of our residents have been hospitalized. 169 of our Marin County residents have passed. Almost one every 2 days, about one every 3. It's obviously this has been a really challenging and unprecedented year for all of us. And I want to just start by thanking you as a board and as our community as a whole for the hard work and the sacrifices we've all made to weather this together. It is not behind us, but I think we've demonstrated that we have what it takes to manage this as well as it can be managed at the population level as a community. And we're doing everything we can to mitigate what is just one of the most challenging natural challenges we've experienced as a society. I think that some of the data I have to share with you today show some of that hope that we are starting to see the light at the end of the tunnel. Both in terms of our case rates and increasing vaccination rates. So what you have here is our case numbers, and then on the bottom you see our epidemic curve showing the 3 waves. That very small, but now comparatively small first wave in March that led to the first shelter in place. As you remember, Marin was among the first counties to issue a shelter in place to really at that time, we were not sure what the mode of transmission really was for COVID-19. This was a new virus at that time. So much was unknown. Remember, we weren't even aware of the vital role of mask wearing and social distancing in those earliest days. And then the surge that we experienced in June and in July and August, that was primarily characterized by extreme numbers of cases among our Latinx essential workers, about 80% of the cases all in that surge among that community. And then the surge that we experienced starting in late October through November, December, fueled by Thanksgiving, Christmas, New Year's, that resolved in about mid-January. And we've seen fairly progressive declines in cases since that, moving from the shelter at home to the red to purple tier and now into the red tier. We are now in our 2nd week in the red tier. Next slide, please. And this shows when it comes up, should show that the state of California, we are in Marin among the 4% or so counties that are currently not in the purple tier. So if you recall back in October, we are among the last counties to be placed into the purple tier. We're also among the first counties to move out of the purple tier. And again, that's testimony to our community as a whole. We can describe the policies at the public health level, but really our success in terms of our case rates, hospitalizations, and deaths is reliant upon the behavior of our community and everyone coming together. And I think, again, the fact that we have probably spent less time in the more restrictive tiers than almost any other county of a medium or large size is because of the hard work of our community and the unique characteristics, I think, of Marin, one of our particular strengths. Next slide, please. This is the vaccination progress so far. We've vaccinated, we've offered about 86,000 total vaccines for 59,000, almost 60,000 individuals who have been vaccinated. About 10% of our population is fully vaccinated with both doses, and about 23%. So coming up on 1 in 4 residents in Marin County have been vaccinated with at least 1 dose thus far. Next, please. And this offers the breakdown of those who have been vaccinated by age. As you know, we've been focusing our vaccine distribution plan on really saving lives, and that has led us to an age-based criteria. So we are focusing on those age 65 plus, and this shows the progress we've made. Among our residents age 75 plus, we vaccinated over 82%. This data is a couple days, lagged. So we're probably up to closer to 84, 85% of our 75 plus. There's only about 4,000 residents now across Marin County in that age group who remain unvaccinated. And then getting to the 65 plus, we're at about 70% of our residents age 65 plus who have been vaccinated. And that progress has allowed us to move into the next tier, or to open vaccinations to our essential workers in categories that I'll describe later. Next, please. And this just describes vaccination rates by county across the state of California among medium and large counties, and shows that Marin County has the second highest vaccination rate. And this is really, I think, in large part due to the collaborative effort that we've been able to achieve in Marin County between our hospitals and public health to make sure that we're moving doses as quickly and efficiently as we can when we receive doses. And I'll describe more about that system shortly. Next, please. So who's being vaccinated in Marin County? Beginning on March 1st, the state of California will be more deterministic, or have more control over statewide eligibility. And this was the quote from the governor in his press conference this week. All vaccine providers and local health jurisdictions will move to a uniform state-directed eligibility criteria, eliminating confusion on who is eligible to receive a vaccine on a county-by-county basis. So up to this point, it has been up to each county to determine who within the tier might be prioritized or eligible. That has led to a lot of confusion across the state, and different counties moving at different paces for different populations. So the state is now declaring as of March 1st, who will be eligible across the state and within each county. Next slide. And for Marin, what that means is that we are in, as everyone else across the state, we are in phase 1B of tier 1. And that means residents age 65 and older, as well as the sectors of education and childcare, food service and agriculture, and emergency services workers are now equally eligible to be vaccinated in Marin and across the state. And then beginning mid-March, residents age 16 to 64 with medical conditions will also become eligible to be vaccinated. We also know that the state is moving towards an age-based framework, and the residents age 50 to 64 will be in the next tier. We have not been told by the state when we will be opening vaccines to members in that age group. Next, please. So these are just a quick summary of the planned vaccinations for next week. We have about 18,000 doses. We try and track all the doses that are coming into Marin County, whether it's coming to our pharmacies, coming to our hospitals, or into public health. So this is an approximate total. We estimate that we'll have about 11,000 first dose appointments. So about 4% of our population we expect to be vaccinated, newly vaccinated this coming week. And then I have described here the different sites in Marin where vaccines will be offered primarily. So with Marin Center, as you know, this is our super pod. This is our primary engine of vaccinating our residents. Opened on December 21st. We vaccinated over 25,000 people in that one site alone. We're able to do 1,000 per day routinely. And this week we've set aside sector-specific days because of those essential workers who are now eligible. a day for food service workers, 1,000 visits dedicated for them to be able to register, a day for childcare, and a day for educators where we're going to be able to vaccinate at least 2,000 educators on Saturday that's coming up. I'll talk more about that shortly. Marin Health and Medical Center is also vaccinating. Our Canal Pod in Centerville, point of dispensing in Centerville, will be doing 1,200 doses. The ferry terminal, where there's the drive-through site that I've described, will be doing 3,000 doses this week. Kaiser Terra Linda, Kaiser has now has an increased allocation from the state as a multi-county entity, which is good news for all of us. So they'll be doing 5,000 doses, at least first doses this week. And then we have mobile units working with our public health teams, at least 4 different mobile units who are moving to different hard to reach areas to vaccinate residents. They'll have 1,000 doses this week. And then pharmacies, an increasing number of pharmacies are coming online. We have 15 pharmacies now in Marin County who are offering vaccines. And they're all visible on our website. If you go to the how to schedule an appointment on our website, you'll see that all of these options are listed as locations where people might seek vaccinations if they meet the criteria. Next, please. So this is just to drill into that vaccinating our educators. This has been flagged by the governor as a priority. This has always been a priority for us in Marin County. We have prioritized reopening schools right from the start. We were among the first counties to close schools in March. We're coming up on the 1-year anniversary of when we first closed schools, but we're also among the first to reopen our schools and worked right off that, after the very first day that we closed them, we were working with Marin County Office of Education on policies and procedures, protocols that would allow us to reopen safely. And consistent with that, we have prioritized vaccinating our educators. We have already vaccinated about a quarter of school staff in Marin County, and we'll be now endeavoring to vaccinate the remaining 3/4 over the next 2 weeks. Our goal is that all Marin County school staff will be fully vaccinated by spring break, which is April 3rd. That's both doses. And that's going to be a coordinated effort between public health, Kaiser, Sutter, and Marin Health. We have organized 4 different events on Saturdays over the next month. We're calling them Super Saturdays. And they're going to be, again, public health staff, Kaiser staff, Sutter staff, and Marin Health staff will be coming together at the Marin Center, combining doses. Kaiser's providing about 500 doses. Marin Health is providing about 500 doses. Public Health will be providing 1,000 doses on each of those days. So we'll be able to have 2,000 doses set aside for our educators. The first one will be this coming Saturday, March 6th. The second will be Saturday, March 13th. Those are both first dose appointments for educators, and then the corresponding second dose appointments later in March and early April. Next, please. And then just this offers a summary of where we are with our schools. This is our schools dashboard. Just a couple features that have been added to this that I want to call to your attention. On the upper left, we have added the total number of student days that we've accumulated in Marin County since we began reopening schools on September 8th when we were in the purple tier. We have now over 1,166,025 total accumulated student days in Marin County schools. And those are, each day is when one child comes into school for in-person learning experience, that's one day. And this has happened over 1 million times now for our Marin County youth since September. With all those student days accumulated, we've had only 11 cases of suspected in-school transmission. And on the right there, you can see the nature of those transmission events when they occurred based on, as determined by our case investigations. 6 student-to-student events of transmission in school, 3 adult-to-adult, 2 adult-to-student, and no occasions where a student transmitted COVID-19 to an adult that we've determined through our contact investigations. And 91% of our schools are open. So our hope is that with vaccinating 100% of our school staff who are willing to be vaccinated, we'll be able to move from that 91.4% to 100% of our schools. We know that a significant fraction of those remaining 10% of schools are planning to open this week because we are now able to open because we are in the red tier. Next, please. And this is just a reminder, because an increasing fraction of our population, almost 1 in 4 of us, are now vaccinated, to remember that after you've been vaccinated, we must continue COVID-19 prevention measures. We have to continue to cover our mouth and nose with a face mask. maintain physical distancing, avoiding crowds in poorly ventilated spaces. And this is, again, the reminder for all of us. But even after you've been vaccinated, these are the important practices to follow: washing our hands and disinfecting frequently tested surfaces. Next, please. And then also another reminder, one thing we found is that our testing rates have declined significantly. This was obviously in the summertime and through the fall. Increasing testing options was a major priority for us. Marin County had some of the highest testing rates based on a lot of aggressive work to acquire more and more testing resources into our county. What we have found is that test-seeking behavior, fewer people are looking for testing now. And so we have far more testing appointments now countywide than we have actually people seeking testing. And my concern is that people may forget that the virus is still very much active and part of our community. We are just into the red tier. When we were in the red tier before, the demand for testing was much higher. So some of this is just a behavior. We want to remind people that testing really is an important community prevention tool. And anyone should seek testing if they're feeling sick, because it's quite possible that could represent COVID-19 infection, only detected through testing. Anyone who's had close contact with someone who we know has COVID-19. And then again, people who are in frequent contact with the public, essential workers, we've recommended that testing monthly for those groups. And if you go on our website, you can see the range of free testing option. There's no cost. Our curative testing sites have multiple open appointments each day. So don't forget that testing remains an important priority for us. Next, please. So in summary, our case rates continue to decline. We are in the red tier. This is our second week in the red tier. More and more counties across the state will be coming into the red tier, but we are in that small minority now who made that progress last week. Backsliding remains a real concern. This is definitely not a sign that we can let down our guard. If we want to maintain our status in the red tier and indeed move forward into the orange tier, we're going to need to continue to do what we know we can do well, which is all of the practices that I just described. Vaccination plan is increasingly controlled by the state, as I've indicated in terms of the essential workers coming online as a statewide plan. The majority of the high risk in Marin County are protected with 82% of our age 75 plus residents and 70% of our age 60 plus vaccinated. We are focusing now to expand on to essential workers, and the first dose for all teachers and staff will occur within the next 2 weeks. Next, please. Thank you. That concludes my presentation.
Thank you, Dr. Willis. Questions of Dr. Willis? Supervisor Rice, anything today?
Yes, good morning. Dr. Willis, on the last couple slides around testing and then also around behavior, could you speak to what the guidelines are going to be around travel over the next couple months, and also what sort of recommendations you're making for folks, family members, as they make plans around Easter break or spring breaks, things like that?
Yeah, if I have any concerns, it's that people are going to see that this is a sign that we can change our practices and behaviors. And the most important single message is that we are not ready yet. This is so that the travel restrictions that have been in place remain in place. And these are recommendations. So it is not safe to travel right now. It still remains. It is against public health advice to travel outside of the region, to do airline travel. There's concerns that there's other areas that have much higher incidence than we have here in Marin. There's also concerns around the role of variants. We're seeing an increased number of variants across the nation that have different characteristics, increased infectivity potentially. And one of the main ways the variants can spread between communities is through travel. So we really want to, as we get into spring break, this is not, we're not ready yet for people to travel more than they have been traveling. And we're hoping that the CDC will be offering, recommendations for people who have been vaccinated. It's reasonable to assume that the risk is reduced because we know that it is 95% effective vaccine. I've been hearing a lot of questions on what does that mean for me in terms of my personal life? Can I engage in travel now that I've been vaccinated? Can I gather with friends now that I've been vaccinated? The fact is that we don't yet know enough about the way the vaccines relate to infectivity. We know the vaccine reduces your risk of serious illness and death. It may still allow people who are post-vaccination to be as infectious to others. They may be infected and be as infectious to others. That wasn't part of the studies. And until we know more about that, we're not recommending that people who are vaccinated change their practices in any way until we have better evidence around that and more formal recommendations from the CDC.
Thank you.
Supervisor Moulton Peters. Okay, Supervisor Conley.
Thank you. Good morning, everyone. Thanks, Dr. Willis. So Marin will be using the state vaccination enrollment process, My Turn, as we've heard through the state. Wondering if you can tell us what that would mean for people who have already expressed an interest through the vaccine interest form, and where do things stand, and what may a transition look like for community members into that new system?
Yeah, this is a familiar dynamic for us, which is, we move quickly in Marin County, so we develop our tools, we develop our policies and procedures, and then a couple of weeks, 3 weeks, 4 weeks later, a month later, the state develops a parallel and analogous process, and then we have to shift across. So that's where we are right now, is that we developed our vaccine interest form for Marin County. We've been using that to signal to people that they're ready for their appointments as they become eligible. The state now has a very similar platform called My Turn, where people are able to go and register, put their name, their contact information, and characteristics about themselves, including their occupation. And then the state will actually reach out to them when their group becomes eligible to offer them appointments across that broader range of appointments now available statewide through the My Turn registration platform. So we are now moving into transitioning away from our local version of that to the state version of that. So everyone who has registered in the Marin County VIF, the vaccine interest form, is being communicated to that they should actually do the same process. Unfortunately, there's no easy way to migrate the data from our system into the state. So they basically have to re-register. It takes 3 minutes to re-register for that same form at the state. So we will be sending out a communication and a public health advisory for instructions on how to register for My Turn. And that's also the process. We're now opening appointments in Marin County through My Turn. That will be an increasingly common portal for people to access appointments for vaccination across the state. Kaiser is going to be moving to My Turn I would estimate by the end of March. My Turn will be the primary tool for anyone across the state, including in Marin County, to find appointments and to be notified of their eligibility.
Thanks. Really appreciated your update on the vaccination of teachers. It's an issue we're all closely following. And specifically, it sounds like the expectation is that the majority of teachers will be vaccinated by spring break, which is great. Another issue on the education front that is on people's minds is, of course, school transportation. Wondering if you can give us an update specifically on, do you foresee any changes coming up on bus capacity for schools, which has been an issue as things start to ramp up even more so with in-person learning?
Yes, we are planning to revise. We're in the process of revising the school transportation guidelines. We had, as we do, erred on the side of caution in the first set of guidelines, where only one child could sit in any given bench and they had to alternate between the window and the aisle. That ended up being, a practical limitation on actually getting children to school because only so few could fit on any given bus. We also learned that was not a significant source of transmission in any way. with the windows down, facial covering. And furthermore, the state has offered more specific guidance on that. That's going to allow us to have more children in buses now with 2 per bench, with physical distancing and facial covering with windows down, et cetera. So yes, it's going to be easier to be getting kids to school now through public transportation.
Great. And last question, I appreciated, from what I understand you say earlier, in terms of who gets vaccinated when, we really are closely tracking kind of the state tier system and how vaccines are being allocated. We do frequently get questions from different groups, all worthy of priorities. Certainly, no one questions that, but just want to make it clear, and maybe you can comment on it in terms of judges, deputy DAs, public defenders, other forms of essential workers. What is the plan going forward? It sounds like it really is at this point to kind of track that state system.
That's right. And we're looking, because the state has declared that they are actually assuming full responsibility for eligibility across the state and not county by county. We're hoping that the state is able to offer as much specificity around that as possible. Right now, food service, the sectors that are described are relatively clear. The one designation of emergency services would be the only category, because now emergency services workers are eligible to be vaccinated. And so some of the conversations are, do we designate certain workers, for example, certain bus drivers or transportation, as emergency services workers because they may be called upon to offer support in emergencies for transportation. Those are ongoing conversations. We will be following state guidance in that, and we are looking for that guidance, and hopefully we'll have answers to those questions by the end of the week.
Great, thanks.
Dr. Willis, for any one of our residents that are over 65 and maybe having trouble with using the internet or getting an appointment, do we have any way for them to contact us? Is there a phone number available yet?
Yes, we do. And I apologize that was not, I'm going to bring up my screen again, if that's okay, and just share that appointment. Actually, you know what? What I'd like to do is just read the number.
Sure.
So yes, so we have established an access. Thank you for asking that, Supervisor Rodoni. So the number is 833-641-1988. 833-641-1988. And we know that we've got 4,000 of our community members above age 75 who have not been vaccinated. And I would ask if anyone in our community knows any of those individuals who are seeking vaccination to call that number, 833-641-1988. And this will be, visibly prominent on our website and other forms. I'll put out a public health advisory on this. And that's for anyone who's having trouble scheduling an appointment or having access to getting an appointment, age 65 or older, or persons with disabilities of all ages, including youth. We're encouraging people to use the online registration platform to make sure that this line remains free for people who need extra assistance to get appointments. But there is now a phone bank that it's a multilingual interpretation service at that phone number for people to call for appointments.
Thank you, Dr. Willis. So Al, let's go to public comment now. Public question allow 2 minutes per speaker, please.
Okay, the first speaker is caller with telephone number ending in 713. Please unmute. Go ahead. Please unmute your device.
Why don't we go on?
Yeah, we'll go to the next caller. Next speakers. The next 3 speakers are Rodrigo Izquierdo, Jeff, and ATU Local 1575. Rodrigo, please unmute and you have the option to share video.
Can you hear me now?
Yes.
Oh.
Go ahead.
Thank you. Okay, so this is Mimi Willard calling. And I want to ask you, please, Dr. Willis, to consider, as you're working through Marin allocations, giving priority of the mRNA vaccines to the seniors, certainly at the 60+ level. And the reason is because these people are the ones who are at the most risk of dying. And while the adenovirus vaccines, like the ones so far approved for J&J and the AstraZeneca, which is still pending, the data for those show that either effective in the elderly as they are in younger groups, or that we're not sufficient data to provide a level of efficacy. So I think the goal is to save they should be prioritizing the 60+ group. Also, there is some lab data that suggests that the adenovirus vaccines are less effective in the elderly because they have been more exposed to natural adenovirus over the course of their lifetimes. So I think you could achieve the public health goal here of getting herd immunity by just getting a whole lot of vaccine out there, and yet at the same time saving lives by prioritizing the mRNA vaccine for those who are most likely to die. Also, I have a question for Dr. Willis for clarity. You said in your slide that the next tier, you have not been told when that will be for 50 to 64-year-olds. I couldn't tell from your comments whether you expect that quote, next year, unquote, is the same tier as the disabled and those with pre-existing medical conditions, or whether that next tier would be a lower tier behind them. Thank you.
The next speaker is Rodrigo Izquierdo. Rodrigo, please unmute and you have the option to share video.
Hi there. I keep saying your screen is up here. Well, I guess that's what you want for the phone numbers. But anyway, Dr. Willis, I wanted to talk about a couple of things that's in the news, which is pretty much what the public sees. And one of them is a paradox because like about 10 days ago, you opened up the Larkspur Landing drive-in clinic for the public. And at the very same time, you cancel the Civic Center appointments. So on one hand, you're accepting people at the Larkspur Landing, and you anticipated 250 people, but at the end of the day, you got over 430 people. So in a way, you seem to have enough vials on hand to take care of them, but you don't have enough vials for the people who had appointments. And since the issue is appointments, why didn't you just transfer the people from the people who had the appointments to Larkspur Landing? So, these people who have appointments, they might be in critical condition. Seem like there's a lapse of care there as to why weren't those people given some kind of priority, since they already went through this giant loophole to get an appointment. Now, it's a problem to get an appointment, so why didn't you refer them over? So anyway, that's one concern, which I think is a paradox. Another one is, what are you going to do about urgent care? Another thing that's in the news. Urgent care, as you know, has been told to return all their vials of the COVID, because they were letting people jump the line. And anybody who wants to get a shot from urgent care, all they had to do was say, I am a first responder, or I'm having health issues, in which case they were given the shot without any more questions. So that seems to be a privileged thing, because it's a membership place where you pay $199, in which case then you get a shot. So the question is, they already got their shot. So what are you going to do about those people who actually, fibbed on their available, for the fact that they should not have been given it. Are you going to be screening?
Thank
them
you,
for the second
Rodrigo.
shot?
We got to wrap up. Thank
All
you.
right. Are you going to be screening them for the second shot because they were not qualified in the first place?
Thank you.
The next speaker is Kevin Carroll of Sausalito Taxi. Kevin, please unmute and you have the option to share video.
Thank you, Dr. Willis. A couple of things. First, at a future presentation, if you would, I'd be interested if you'd compare the CDC's graph on the flu epidemic of 1918 versus the one we're going through now. I find it fascinating to look at the two and compare them, since the 18 is based on what did happen as opposed to us trying to figure out what's going to happen. And they had 3 waves in that one, though they don't exactly match. If you think it's relevant, I think it'd be fascinating. The 2 issues I really did want to bring up is one, currently our website shows that there's 4 places in Mill Valley pharmacies that you can get the vaccine at, but nothing in Marin City at this time. There is a temporary vaccine shot at Sausalito City Hall, I think 1 day a week, but there's the CVS pharmacy in Marin City and the CVS pharmacy within Target, not to mention the empty steakhouse site that has refrigeration and bathrooms. And I'm just wondering if anything's going to happen in Marin City for vaccines. The other issue is I am a cab driver, and all of a sudden after a year, I'm getting calls starting Thursday of last week from people who want to travel. I'm getting out of state people that want to come in. I do work for a company where people walk from one hotel to another by Muir Woods and Mount Tam, and I take their luggage, and those reservations are starting to come in for the 1st of May. And I'm also now getting locals who are going to be traveling out of town. And typically with my customers, the ones that have contacted me, I know them. They're all over 65. And in talking to them, they're all going to have had their second shots. It'll be 2 weeks after their second shot. And they're starting to feel, well, then it'll be okay to travel to go see grandchildren they haven't seen. One case, it's a wedding. And I think one is a vacation in a remote location. And I'm
Can you wrap it up, Kevin, please?
I'm feeling uncomfortable both ways. So if you would comment on their travel and my servicing them as a cab driver. Thank you. Even I'll have my shot by then.
The next 3 speakers are Jeff, ATU Local 1575, and Eva. Jeff, please unmute and you have the option to share video.
Great. Can you hear me?
Yes.
Okay, terrific. Dr. Willis, one quick question. I was just curious, as a 51-year-old here in Marin County, your best guesstimate on when I might be able to get either the Pfizer or Moderna vaccine. Second question, a little more complicated. You'll notice I did not say Johnson & Johnson. Given what was approved is significantly less effective, 72% versus 94% on an overall basis than the previous 2 vaccines, there seems to be a effort almost to spin the results. I hear government officials, I hear media comparing its ability to prevent serious illness, 85% to the other 2 vaccines, which isn't necessarily kind of apples to apples. And it seems like misrepresentations at the start of this pandemic got us into a lot of trouble. And I'm wondering, if we're going down that route again by not kind of being honest with people about the data we do have, even though it's flawed, that is what it shows. And then, the second question, I guess, just related to that, I wouldn't accept the J&J vaccine. From what I'm seeing on social media, I'm kind of not alone in that opinion. Do you see that creating an issue here, similar to what's happened in Europe, where people have started to reject vaccines they perceive as less effective? Thank you.
The next speaker is ATU Local 1575. Please unmute and you have the option to share video.
Chair Johnny, good morning, fellow supervisors and Dr. Willis. My name is Shane Weinstein. I represent 250 bus operators at Golden Gate Transit, but I also represent 20 bus operators at Petaluma Transit. And there is a stark difference in what is going on between the two counties within my bargaining unit. As you know, San Francisco has made bus operators emergency service workers. We are actually even told the Golden Gate, that BART is now going down there to get their shots, even though they aren't with Muni. So Dr. Willis brought up school and school bus operators. That goes for transit operators as well. I have 33 cases so far. That's 15 to 20% of my membership with one death. And so when we're talking about giving free rides to inoculation sites to make sure that our constituents are getting inoculated, and we're saying that the Golden Gate bus operators are going to be taking them there, I don't know what the definition of essential is more than that. And so I have my entire membership up at Petaluma Transit that did want to get inoculated. They have already done so. That started 3 weeks ago. San Francisco, we've already kind of gone over there. So I just ask that we make that determination that bus operators are emergency service workers at this point. And I do want to bring up that Larkspur Ferry terminal site just really quickly. I have 5 people working down there. What I am seeing logistics wise is the ramp up of getting enough vaccine to the site and then also having that vaccine thawed is what we're having a problem in not moving everybody through. And I also need to let everybody know here that there is going to be a need for people working, many more people working that site when this does start ramping up, because it was really difficult with the logistics before. We're going to need more people, more thawed vaccine as well. So again, I hope that you will make that determination in making sure that bus operators are emergency service workers. I appreciate your time today. Thank you.
Thank you. The next speaker is Eva. Eva, please unmute.
Thank you. Can you hear me?
Yes.
Thanks. I was fascinated by the first and the last caller, Mimi Willard, and then Mr. Weinstein. And I mean, they're advocating for 2 different things. And I think what I find interesting is that there has been a real priority on senior citizens, which is very important. But it also sometimes leaves out necessary workers who are transporting senior citizens, especially poor senior citizens. I always do find it a bit ironic hearing from Mimi Willard whenever these COVID briefings are given and she makes a comment. Mimi Willard worked for Goldman Sachs and Lehman Brothers. She's head of she founded Coalition for Sensible Taxpayers in Marin. There's something deeply ironic about a Goldman Sachs alumnus saying that she's for sensible taxation, given how much we, the taxpayers, had to pay in to rescue Goldman Sachs. But her job as a healthcare analyst on Wall Street was in part of her job was ramping up the privatization of what remained of our public health infrastructure. And a lot of what we've been struggling with in this country is a profoundly broken public health infrastructure. So I hope we can look at these things on a broader level. I think that Dr. Willis has really done a heroic job, and it's been challenging. It's been challenging for every doctor and every nurse and every janitor at UCSF and every technician at UCSF and every other hospital because of what has happened to healthcare in this country. It's a for-profit system. We're seeing that countries like Taiwan and Vietnam that have universal healthcare are not experiencing these issues. So we should think about that a little more deeply. Thank you for your time.
The next speaker is Charlene Eldon. Charlene, please unmute and you have the option to share video.
Thanks, everyone. I also wanted to speak to what Shane Weinstein said. That's very horrifying to hear that there's already been a death and that bus operators are not already considered emergency service workers. So I'd just like to amplify what Shane said, that is stark and needs to be rectified. However, I'd also like to ground us back in the reality of last year, June 2020, when the Latinx population had 80% of our COVID cases. They were also being censored in these Board of Supervisors calls. They were also afraid to go to the hospital because our sheriff was still cooperating with ICE. This was a bad year for some very, very serious reasons that are very, very embarrassing. Frankly, I keep coming back to this feeling of embarrassment that we couldn't just have adult conversations and hear people who were rightfully upset about the mortal danger that they were put in. And now looking at the graph, we're worse than we were at the beginning of COVID last year. So let's keep in mind that there are deaths on our hands as the white and wealthy Marin residents who haven't been facing the same pandemic and who aren't essential workers being put in danger. Thank you.
Thank you. President Rodoni, there are no additional speakers. There are no additional speakers in the queue. I'm sorry, President Rodoni, we do have one additional speaker, Susanna Farber. Do you want to bring her in?
You bring her in, but Mimi Willard's already spoke, so.
Yes, sir. Susanna Farber, please unmute and you have the option to share video.
Sorry, it kicked me out there for just 1 second. Susanna Farber, I represent the district attorneys with Teamsters Local 856 of County Marin. And we would like to just recognize that Alameda and Sonoma and San Francisco have all designated district attorney and public defender attorneys as well as court staff as emergency responders. Our district attorneys have on-call provisions that requires them to go out to crime scenes when necessary to assist law enforcement, and jury trials start in Marin earlier than many other counties, March 8th. I know the court system is something separate from the county that you guys don't get a lot of say in, but the courts have announced that they will start their backlog of jury trials March 8th. So we are requesting that those attorneys and court staff that are going to be with the public with jury trials starting next week can be prioritized. I believe the DA and the PD can get you a list of those who will be in the courtroom. It's a very small number, and we're hoping that those folks can be prioritized. Thank you so much.
Thank you, President Rodoni. There are no additional speakers in the queue.
Okay, we're going to return to Dr. Willis now to address some of those questions.
Yeah, I'll start with the Johnson & Johnson question because there was a couple around that. So yes, we are. This is our third vaccine that has now received emergency use authorization by the FDA. The state is due to receive, I think, 380,000 doses this week, and we've been told that local jurisdictions will receive allocations of Johnson & Johnson as early as the end of this week or next week. If it's and we don't know what our allocation will be. If it's a pure sort of per capita basis, we would expect about 2,000 doses based on 380,000 coming to the state into Marin County. We do have plans for how to use that vaccine. It is, as one of the callers indicated, 85% effective at protecting us against what we are most concerned about, which is serious illness. Back in the trials, no one who was vaccinated actually died. So in some ways, 100% effective against preventing death. Our biggest challenge thus far in our vaccine distribution plan has been supply. And the way we're thinking about approaching this is that the best vaccine for you is the one that is available for you. These are effective vaccines. We are in a race right now against the variants, and the more people we can get vaccinated, the better off we'll be as a community. The Johnson & Johnson vaccine, again at one dose, it has a lot of advantages in terms of just the operations and the complexity of administering 2 doses. No matter what we do, there's always some fraction of people who do not come back for the second dose. So that's an advantage with 1 dose. You're getting that level of protection. Serious illness and death. We're going to be using our Johnson & Johnson vaccine for our mobile operations. That's a serious advantage of that product, and that's part of what the state has actually recommended, is that the Johnson & Johnson vaccine be used for certain forms of operations based on that characteristic of being effective and available in a single dose. So we'll be moving, again, our four mobile teams will be using the Johnson & Johnson vaccine. It's important to step back and also remember that every vaccine is voluntary. We are not requiring anybody to get vaccinated in Marin County. The demand, fortunately, we have significant demand for the vaccine based on its safety and efficacy. But no one is going to be required to be vaccinated with any one product or another. So our goal will be just to communicate to the public as much as we can around clarity about the different vaccines, their different characteristics, following state guidelines that have not been finalized yet regarding the Johnson & Johnson product. We're being told it's not the Johnson & Johnson, we're calling it the Janssen. So we'll start referring to it as the Janssen product. But that big vaccine is coming into Marin, and we'll have more clarity from the state in terms of its performance and its efficacy and its recommendations for the state. But we do see it as a huge asset to us, given that again, the major barrier for us is just the lack of product between the Pfizer and the Moderna. The question regarding One Medical came up, and I think this has received a fair amount of attention regionally. One Medical is an urgent care and primary care provider in the region. We had, like many of other jurisdictions, had allocated some doses to One Medical so they could provide it to their patients. We then learned that in some settings, One Medical may not have been following the guidance in terms of who to vaccinate, and following what we had determined as one of the preconditions of offering any provider vaccines in Marin County. The precondition was that they follow the rubric that we had determined. So focusing on age, focusing on those essential workers. Because there was concerns regionally about whether not One Medical was in all cases following that guidance, we suspended offering One Medical any further doses. We are not now supplying One Medical doses until that has been determined and there's an investigation underway. And Marin, like San Francisco and other counties, are basically taking a cautious approach here and not offering them any doses, aside from second doses that they would need to complete the regimen for those they've already vaccinated. Marin City, there was a question about Marin City. We are working with the Federal Qualified Health Center in Marin City Health and Wellness Clinic, to help or co-host a vaccine clinic with our mobile operation. So we will be moving to Marin City this week to begin vaccinating residents in Marin City with it's one of the great assets of a mobile team, is that we're able to get into communities where people are not able to travel to our mass vaccination sites. So the options are obviously the mass vaccination sites, the ferry terminal, the Marin Center pod are equally accessible or open to anyone across the county. But there are certain communities, if there's issues in terms of transportation or access, we will be actually traveling to those communities, and Marin City is one that will have regular visits from our mobile vaccination team. The CVS, this is a federal program, so we have 2 CVS pharmacies in Marin County that are now offering vaccine. One is in San Anselmo, one is in San Rafael. We do not have control over where CVS places their vaccine operations among their pharmacies, and we advocate and we request, but at the end of the day, it's up to them, and they have not chosen to include the CVS pharmacy in Marin City as one of them yet. Transit operators, there was several calls regarding prioritizing transit operators. I did indicate that we are now, as of March 1st, really adhering to what the state recommends or requires as the sectors that we are able to vaccinate, and we are seeking guidance from the state on that. What's challenging is that the state has formally designated transportation sector as being in one of the later tiers. So the question is, are we able to carve out a certain sector among that transportation sector for people who might be deemed emergency services workers? And the arguments that were conveyed are well heard from today. And then for the final comment regarding our Latinx essential workers, I think one of the key strategies for this particular tier right now is we're vaccinating essential workers. There's about 98,000 Marin County residents who fit into the current tier. We have 260,000 total residents. So think about that. More than a third of our whole population fits into the current tier based on eligibility criteria by virtue of age or being in one of those essential categories. Many in those essential categories, food service workers, agricultural workers, childcare, education, are essential workers who were disproportionately impacted by surges in cases in our Latinx community through July and August and ongoing. And so our strategy for vaccinating to address that and protect that community that has been particularly hard hit matches really well with the sectors we are now able to, under the state, vaccinate currently. And so really to us, the tactics are around making sure that we're really reaching everyone in those communities who qualifies by virtue of occupation. And that's working with our community-based organizations, our faith-based organizations, our community clinics across the county, and with offering mobile options, offering support through telephonic assistance, bilingual telephonic assistance, and getting people in dedicated clinics like we have established at the Marin Center this week for food service workers, childcare workers, educators, to make sure that we're vaccinating those who are at highest risk of infection as we've seen over the past year.